Welcome everyone to Patient Voices Across Europe podcast. In this series, we speak with members of ELPA Steatotic Liver Disease Working Group, a dynamic team of advocates from across Europe committed to raising awareness and driving change around steatotic fatty liver disease. Each episode brings you local insights, patient perspectives, and solutions from the ground up. Our guests are not just ELPA members. They are change makers working within their communities to shift policies, fight stigma, and empower patients. So thank you very much for tuning in. And today I am extremely happy to welcome in our podcast studio Selly Sickout from France.
Yes.
Hi, Selly.
Hi, Veronica. It's
How are you?
a pleasure for me to be here, to be with you, to represent a French network of patients living with liver disease and also as ELPA member. So thank you very much for the invitation.
We are, of course, happy to have you here. Thank you for your time. And let's maybe start, Selly, with describing your association, your team. What are you doing in France?
Yes,
Tell us more.
Few words. Our network will have 30 years old next year. And we come from viral words, and in the reality, in the real life, they're all liver aggressor. So we have the difficulty of sedentarity, physical activity also, food, etc. So all that aggressor are not good for liver, and we have patients cured from Hépatites C who also have liver steatotic liver disease or MASH after, etc. So our aim is to inform people, to raise awareness also, but to defend people living with liver disease and to support patients, and to do prevention, a lot of prevention, because we have an amazing organ, and it's really possible to stop the disaster and to be in control, or to also reverse situations. So prevention is very important for us. So in that way, we work today with viral hepatitis, because we have elimination is not okay even in France, and there's also metabolic liver disease, unfortunately. So we work on it, and it's very amazing to work with all patients, because there's unfortunately a lot of disease links to metabolic trouble. So it's a lot of work, but it's a huge work, and as ELPA say, together we are stronger, so we try to do it.
It's really funny because I think majority of speakers in this series, where we are giving patient voices the platform to speak up and to be heard, they all saying, together we are stronger. We have to go together, because otherwise not that we don't stand a chance, but it's much easier. I think there are a lot of obstacles on the way, and it's just this support network and maybe some good messages from colleagues, from coworkers, can really put you back on the track and doing things that we do every day, right?
Completely. And we know that with this metabolic disease, people don't die because of their liver. First of all, there's other disease, but it's difficult to have people with diabetes and also liver disease, and never done liver diagnosis. So we really want to have less patients with liver disease as possible, and it's not a dream, it's possible. So we work on it, and even if there's first of all, the number of patients, there's more obesity, there's more diabetes, etc. But we have to work together to the daily life, to the quality of life of patients and every users. And we know that it's not easy to lose weight. It's not easy to do physical activity, but maybe with liver and with this amazing organ, we could give another life also to prevention, because it's not easy, and we know that. So I think I really think I'm really sure that with liver we can improve prevention.
Prevention, early diagnosis,
Yes.
systematic care, these are focuses of your association. You're also very active member of our working group, SLD Working Group. You're always coming up with new ideas and this powerful vibe that I really like every time I'm joining you. But Selly, maybe tell me, where do you see strength in this let's say process of connecting with others? So where do you see maybe the strength, or is it the right way to go, or should we all stay in our own silos and work separately?
I think we can't stay on our side, but it's not easy because, for example, in diabetes, when you are healed, you have a lot of diagnoses, you have a lot of tests to do, and it's important. All the tests are not done, so thinking about adding a new test on liver, it's could be very difficult even for health professionals. So for patients, it's another difficulty, because in all country we have not enough health professional, etc. So we have to deal with that because unfortunately we have now too many patients and not enough health professional on one side. On the other side, you have also the control, also the follow-up system, and the accessibility, etc. It's not easy. So I thinking about patient association organization. We have to work together. Even if it's not difficult, even if we have a lot of topics to deal with every day, we have to try, and step by step we talk about each other, we deal with the same project, etc. I'm sure it's a way to work, even if time flies, unfortunately.
Being on a front row of a big national patient association in France, do you maybe lack a support, or can you maybe share with us some good support that you are experiencing in France, that our audience, maybe other representatives of other patient association, can learn from or get some good advice from you?
It's a pleasure for me to talk about our support, and also the reality of public health politics. We don't have the main patients. So first of all, I lot of talk about diabetes or obesity. In France, obesity is not considered as a disease, but there are specific center, etc. For liver disease, we have historically planned on viral hepatitis, but today, when you talk about MASH at health ministry, we have to go work together. Even the different there is different subject, for viral hepatitis, HIV, non-transmissible disease, vaccination, etc. They all have to work together also to know how they have to deal with subjects like MASH. So we are lucky because we have the support of health ministry, and we also have several institutional support for a challenge, but I don't talk about it now. We are very happy, very lucky, because we have the support of the National Institution on Health, on Medicine, and on Science in general. Important institution who also a lot of work on communication. So this institution is very near from every users, So it's very important to have the support of this institution. And we also have specific institution on viral hepatitis, etc. So even if time are financially difficult, we have health authority support as they can, because liver disease is not a priority Now we had a priority with viral hepatitis. But now it's not the same priority, and with MASH, it's not a real priority. So we have to deal with every actors to know what we can do, and it's the reason for me that prevention. We can work a lot on prevention, because we a lot of talk about prevention, but it's not. We have a lot of to do.
So that's a good sign. It's a good sign to know that there is a big chunk of work to be done, and I hear from your response that you have supporters, that you have agencies, institutions that you can count on. Also, I think the importance of visibility of your messages. This is a crucial part, because if you prepare a nice leaflet but it stays somewhere locked in the room, it doesn't make sense, right? So that's always good to hear.
And it's also important to add that we have also industrial support, and it's also an historic partnership. I can say that, and it's important for us, because we want innovation also in liver disease, and
research is
innovation, and with viral hepatitis we used to work with industrial to let them know that is good, that is not good, that is not real, etc. Interaction, side effects, etc. So it's also important partners.
Selly, let's touch a little bit on one of your social media campaign that it's really standing out, and really let's devote some time and give you the time to present what is the main aim of that, for how many years you've been doing that, what is the progress, what are the results. So I'm giving you the floor. Tell us all about that.
Thank you. It's a great pleasure for me. We are in June, and it's a great pleasure for me to talk about you, about June, the challenge June without added sugar. It's a third year, this 2025, and it's our president says as patient association we have to dream, and we have to be in action. In 2023, so it was like a bet between volunteers, inspired by no tobacco months, by dry January months. We know the collective strength of such challenge, and we want also to add advice, to add shares, to add documentation, to also have support, and to also have, because support, and I will say how the bet started. In June we have a lot of picnics, we have a lot of snakes, etc. It's summer, and in our association, patients told us, no, it's not possible for me. I don't want to say anymore. I don't drink alcohol. I have to be careful with sugar. So I don't want. I prefer to not participate to such events. And for us, it was very violent. No, it's not possible. And the main problem is sugars, and decrease the consumption of sugar is important for everybody. It's good for everybody. So let's go and have this challenge 1 month, because we stay inspired by the other challenge. It's a good time, and let's go and try to first of all be conscious about what we eat, be conscious about the link with the sugar, with added sugar. We eat a lot of processed and foods also. So to be conscious, and if it's possible, but always with good mood and without frustration, to try to reduce the level of added sugar. For example, it could be, I will not put sugar in my coffee, for example, all these months. I will not drink soda, for example, etc., etc. And it's individual objectives. and you can decrease, you can go higher if you want, all the months along. And we share recipe, we share difficulties.
That was my next question. Yeah, what is actually the content of this campaign? So are you sharing these informative messages, or are they recipes, or are there any other tips and tricks? Walk us through a little bit about the content.
About the content, we have we wanted to work on the collective side, and today the main tool we chose was Facebook group, first of all, and we also share a survey. And last year we did a specific website, and on this website we put a lot of flyers, a lot of tools, a lot of how to when you buy a product, what should you look
so also like really practical examples, how to take this theory to practice.
Practical information. We work on also on videos, etc. But we did it with it's our association work. We don't have a lot of, we have help support still the beginning, but we don't have public support. We don't have industrial support for the moment. So all these tools are homemade, and
which is sometimes sad, right? Because it's an important campaign. It's a campaign that reaches a lot of people. It's you're working on increasing the awareness, which is part of also health literacy, which is extremely important.
I will not say sad, but we want to be concrete, and we want to talk to everybody, and it's the difficulty to not have enough time, to not have enough resources to do important tools, for example. That is sad for us, but we do it with a lot of we really believe in it, and with a lot of joy, and people shares are very amazing, so it gives us a lot of energy.
Positive feedback.
Positive feedback, yes.
When you see that you are reaching the results that you want. One question: how many do you have? Like a number? How many participants? How many people are participating?
Last year in 2024, it was 3,600 participants. So it was amazing, and we really hope this year we will have more participants. But even if we don't have more participants,
what is your aim?
I dream about 20,000. Why not? We know the work we did, and we know all the institution, organization, all patient association also who support the challenge. Numbers are important, but we think also about all people who say, I will do the challenge, but I don't want to subscribe. I don't want to have too lot of pressure, etc. But we are very happy because this year we have more professional health also institution, our association support, more association, etc. And we say, yes, if it's for the month, but if you didn't start the first of the month, it's not no matter. Take the train when you can, and do this challenge with us, and see together at the end what is your difficulty, what is the benefits for you. If you want to support us this year, we'll work with a research team, and so we have also very happy of that. We are very honored because it's the strength of the patient association, what we can do, and we can give data, we can help the health system to improve, etc. And we dream of, for example, when you will go to, when in the future, or maybe now, when you go to the doctor, they ask you, what about your sugar consumption? Do you think you have an addict relation with sugar or not? And we really want people to be helped.
So I can see that you could talk about this this campaign for another hour, which is always nice to see. I mean, you are the leading force behind it, so we need people like you that will just go through the wall, if I may say so, and you're certainly doing so. Selly, thank you very much for joining us today.
And this, I really want to add that it's a personal but also collective challenge, and it's really important. Even if you don't want to participate to the collective way, it's at your individual level, you link with sugar, and it's important to know I take care of me, I want to reduce my stress, and I want to be better. So it's really good for health in general, and for a patient association to talk about liver. It's also very, very important. So it's very cool.
Thank you very much, Selly. I think that was a very nice closure to our episode. So thank you very much for tuning in to our audience, and we will be back with another podcast series with other patient advocates. So stay tuned for more, and have a nice rest of your day. Goodbye.
Thank you. Goodbye.